The COVID-19 pandemic has been really tough, but new vaccines give us hope that things will soon get better. They are safe and effective and key to protecting ourselves and our loved ones. Getting vaccinated will help our communities reopen and get moving again. While having vaccines is exciting and a huge relief, it's understandable to have questions and concerns. How do they work? Are they safe? How are they made so quickly? Were they tested on people like me? And how can I get one? Vaccines have been around for a long time and are safely used all around the world. They have protected millions from deadly diseases like smallpox, polio, measles, and tetanus. The new COVID-19 vaccines train your body's immune system to react quickly and protect you from the coronavirus. This greatly reduces your chance of developing COVID-19, and if you do, the infection isn't nearly as dangerous. Each of the vaccines approved for use in the U.S. is extremely good at keeping people from getting seriously ill, having to go to the hospital, or dying. The different vaccines have slightly higher or lower rates of effectiveness, which is normal. What's really important to know is that all of the vaccines are safe, and they're really good at preventing serious illness or death. Given a choice, which vaccine should you get? Whichever one is available to you first. It's more important to get vaccinated than it is to worry about the minor differences between them. The vaccines do not contain any live virus and can't give you COVID-19. They do not change your DNA or genetic material. The vaccines do not contain fetal cells, animal products, or microchips, and they do not cause infertility. After getting vaccinated, your body needs time to build up immunity to COVID-19. Continue to protect yourself and others by wearing a mask, keeping 6 feet apart, and washing your hands. It takes 2 weeks after your last dose to build up enough immunity to protect you. Once you are vaccinated, you can meet with other vaccinated people in small groups without masks, but continue to practice all recommended prevention measures when in public. It's important to know that all the vaccines completed the same steps before approval for use. They were tested on tens of thousands of volunteers, checked for safety, and proved incredibly effective. Experts reviewed all these results before approving the vaccine. Nothing was skipped. For COVID-19 vaccines, researchers worked hard to recruit diverse volunteers for their studies. They included diversity in race, ethnicity, age, and health conditions. The studies ended up actually being more diverse than other vaccine studies have been in the past. The mix of people participating in the studies looks more like the overall population of the U.S. Vaccines usually take years to study and make. This time, the process was quicker because scientists had learned a lot from making vaccines for similar diseases like SARS and MERS. In addition, cooperation between researchers, the government, and private companies shortened the usual timeline by increasing funding and overlapping the usual steps. While none of the vaccines contain a live virus and cannot give you COVID-19, you may have some mild side effects. These are common in any vaccine and are a sign your body is doing what it's supposed to do, building protection against disease. Common side effects of the COVID-19 vaccine include soreness or redness where you get the vaccine, a headache, tiredness, and sometimes a low fever. These symptoms usually go away on their own within a few days. It is rare, but some people have had a severe allergic reaction within a few minutes of getting the vaccine. That is why you are asked to wait for 15 to 30 minutes after you get vaccinated. Medical help will be available at your vaccine location if you need it. Tell the vaccinators if you ever had a severe allergic reaction to a vaccine or other injection. The COVID vaccines are free to everyone who lives in the U.S. You do not need to have health insurance, provide a social security number, or a credit card number. Vaccines are the best tool we have to end this pandemic, but it will take time for enough people to get vaccinated in order to keep our communities safe. Until then, when you are in public or around unvaccinated people, continue to do what we know works to help stop the spread. Wash your hands often, wear a mask, watch your distance, and keep gatherings small and brief. Vaccinated people can meet each other in small groups without masks. If you have specific questions about your health and getting vaccinated, contact your doctor or health clinic. If you don't have a doctor, call 211 to help you find one. They also have the latest information on when and how you can get a vaccine. You can always visit multco.us/COVID-19 for more information on COVID-19 and vaccinations.